Well, hello. You might have heard me say a few minutes ago. I've been away for 10 days. Something came up in my family and it had to be dealt with. And so now I'm back attempting to do shows. And it just feels very unfamiliar, even though I'm sitting here in a very familiar place, which would be the part of my house that is now a radio studio. So a little bit later on the show today, well, let me put it to you this way. A few days ago, diligently wanting to be a full participant in the funding of our fine democracy, I affixed 2 Ellsworth Kelly stamps to 2 envelopes and mailed various things to the IRS, only to find out a day or two later the IRS has 11 million unopened pieces of mail. So that has consequences for all kinds of people. We'll try to explain that to you. And then, yes, almost everywhere now, people are reporting loud and persistent and not confined to any particular set of hours, uses of fireworks. And that has, first of all, spawned a certain amount of content and, a certain amount of discontent and complaints to the police and stuff like that. But also conspiracy theories. We'll tell you about that as we go along here. But as we usually do on Mondays, we want now to talk about how things are going right now with COVID. The answer is not very good, but we'll try to get a little bit more granular than that. And so joining us today, hold on, I have to use a different piece of equipment here today. Joining us today to do that is Rebecca Katz. Rebecca Katz is a professor and director of the Center for Global Health, Science and Security at Georgetown University Medical Center. Welcome to our show. Yeah, not hearing Rebecca at the moment. Let's see if we can. There she is. I think I just heard her. Hi, Rebecca.
Hi, can you hear me now?
Yeah, there you are. So, I looked back. It was actually June 8th. I was talking to one of your colleagues in this field, Michael Minna, and we were saying that at that moment, if you looked at cases, it looked like there was a plateau in the U.S., but it was kind of a fake plateau. There were a whole group of states, like the one that I live in, that were going down, bending the curve down pretty dramatically. And there were a whole bunch of states that were starting to have new cases. So if you added them all up, they flattened, but in a very deceiving way. But from what I can tell, that's over now. The number of states that can diminish their cases can no longer offset these sharp vertical movements in these sicker states. Maybe you'd like to elaborate.
No, I think that's absolutely right. I mean, we're seeing really disturbing trends at the moment. Over half the country, well, really almost every state, with the exception of just a handful, are seeing increases in COVID cases right now. And about half more than half, are seeing, in some cases, almost exponential growth, or trends that look like it's heading that way. So yeah, we're seeing really disturbing numbers. As you know, we now have over 2.5 million cases in the United States and over 126,000 deaths. And to put that in perspective, we account for approximately 4% of the global population, but we have 25% of cases and deaths.
Right. So, and that's even, one of the few mildly encouraging trends, as I understand it, is the rate of death per infection actually is bending down a little bit, maybe an indication that more young people are getting affected, and also maybe an indication that the U.S. is getting better clinically at treating some of the sick people. But still, that's a crazy percentage of deaths, right?
Right. I mean, I think what you're saying is we hope that's true. Certainly, we're seeing a larger percentage of people who are between 18 and 44 who are testing positive. And as we've learned to date, that their outcomes tend to be more positive, and there's less critical disease amongst that population than an older group. So I think it does say something about the fact that these are that one, that maybe we're doing a better job of shielding our most vulnerable populations, but two, that the younger population is maybe more open to re-engaging in society and possibly more exposed to the virus, but they're but thankfully not getting quite as sick.
So It's not much of a mystery why this is happening. At least I would assume it's
No.
not that big a mystery. I mean, we've got 4 states that represent 8% of the population that meet none of the federal criteria for reopening. They've reopened basically. Although obviously a lot of them are pulling in their horns a little bit now, but the fact that we don't have any kind of centralized set of rules or guidelines that everybody is following, or even close to everybody is following, I assume that's the simpler explanation for what's happening.
Well, it continues to be incredibly frustrating. I think that in the absence of unified guidance and specific operational guidance from the federal government, every state, as well as every municipality, every organization, every university, every single entity is trying to feel this out for themselves. And there, as you just mentioned, approximately 12 states are either pausing or reversing the reopening plans as they're coming face to face with the realities of what increased caseloads look like, and the hospitals becoming overwhelmed. But it is really a challenge. We've had a lot of folks who've tried to get very smart very fast on a lot of details on public health response, and it has, to your point, not been uniform.
Right. And you know, that idea of getting smart fast, I mean, I feel like we're trapped in this kind of continuous melange of the past, present, and future. We're trying to look at the present moment and trying to learn about it in real time. And obviously things are happening pretty fast in real time, whether it's rising case numbers or, I don't know, as of today, now we're talking about a G variant, maybe a slightly different kind of mutation that might be a little bit more infectious. We're trying to understand what's happening at the present moment. We're also trying to figure out how we got into this mess. So we're trying to look at the past, the recent past, to understand, for example, why the asymptomatic transmission was kind of overlooked, even though there were scientists trying to explain that no, you didn't have to have symptoms in order to infect other people. You know, Stat News today ran a piece suggesting we're going to need a 9/11 type commission to figure out all the things that went wrong here. And we're trying to look at the future too, and all that. Each one kind of interacts with the other. But maybe we could just talk about the past for a second. Is there any point thinking about all that stuff right now when we have so much on our plate? Are there things that we can learn from the immediate past that will help us in the present and future?
Maybe. I mean, first I would note that the situation you're describing is not any different than what we do with every emerging infectious disease. When we have a new disease emerge, you're constantly fighting an epidemic under uncertainty. There are things that you're learning as you go, and that's the world of emerging infectious diseases. It's not uncommon to not have all the answers up front. And in fact, that the challenge is actually being able to learn and adapt as you go. And I think that, can we learn from the past? Absolutely. And yeah, I've been joking for a long time that I plan to spend the next 10 years reading the dissertations that will no doubt come out of everything that's happened over the last couple of months. And I think, to the question of should we be digging in now, or should we be focusing on the current and future response? I think, to me, clearly the priority is how do we save lives right now? And that is primarily focused on what do we know today and what do we need to prepare for the short and medium term. But we have a lot of really smart people who are singly focused on this pandemic at the moment. And there is plenty of room for folks to look backwards at the same time that others are focused on the present. So I think that there's, my understanding is that WHO is in negotiations and plans to actually send a team, hopefully next week, back to China to start looking into the origins of the outbreak. And it's hard to tell right now until you know the findings how useful it will be for the current response, but it will certainly inform our understanding of coronaviruses in general, and hopefully this one specifically.
One reason I think to look at the recent past is that there is inevitably, whether we would like to talk about it or not, there's a political component to this whole thing. In fact, I've become addicted to this podcast called This Week in Virology, and all these virologists have people sending emails saying, don't make it political. And the scientists keep saying, we'll stop when they stop. They started it. They made it political. And there really are these two worlds. There's the world of, Anthony Fauci and Rebecca Katz and Michael Mina and Greg Gonsalves and all these scientists. And then there's this other world where, for the first time since April, the so-called White House task force on coronavirus made an appearance in the last few days and really did describe a radically different reality than what you and I are talking about right now. I mean, there are these, calling them two competing narratives would almost be charitable, but there is a way in which people have almost a menu of what they can believe in right now.
Well, first, I'm just going to bask in the fact that you just mentioned my name in the same breath as Dr. Fauci. So I don't feel like I'm in the same ballpark, but very much appreciate the mention. Yes, this has become political, and in part because this is a massive event in our lives, clearly, and it's not just about public health, and we're seeing that as we look into, how public health guidance is used, accepted, not accepted, public health officials being targeted, data being targeted, data becoming political, because it's not just about, wear a mask, don't wear a mask, or, reopen economies, don't reopen schools, don't. There's so many factors that are coming into play. And I think we're all starting to sound a little bit like a broken record. That'd be nice if you could just listen to the public health piece by itself. But that's not the reality of our current situation, which means that particularly those of us who are not in government at the moment, are spending a lot of time having conversations like the one that we're having, and trying to make sure that the evidence, as best that we understand it, is shared with the general public and communicated in a way that people are able to internalize it and change their behaviors accordingly. But it's not necessarily the way it should be, right? It'd be really nice if there was a trusted official public health government official who was doing daily press conferences and not only explaining the latest developments, but also answering the questions that come up time and time again, like the same way that honestly the World Health Organization has been doing daily pressers. And we just haven't had that.
Right. Actually, if you call this progress, Mike Pence and Governor Abbott from Texas gave a press conference this weekend. I think for the first time you might have heard Mike Pence endorse the idea of masks. But let's just hear that audio and see if we did hear it.
When we issued the guidelines to open up America again, we laid out a phased reopening plan. Texas took that plan and implemented it here in a safe and responsible way. But there was guidance throughout that applied to all of the phases. And chief among them was that people should continue to practice good hygiene, wash your hands, avoid touching your face, and wear a mask.
I feel like I'm in cloud cuckoo land. I mean, obviously...
I'll take it. He did say wear a mask. He did actually wear a mask. Now, he wore a mask in front of a choir indoors of 100 plus people singing, which are both, being indoors and singing unmasked, risky behavior. But he did actually say the words wear a mask. So I think we'll take our wins where we can get them.
Yes, I guess. I mean, wouldn't it be nice to see a little modeling good behavior from, the president when it comes to wearing masks? But yes, I think that is... Yeah, go ahead.
But I think that's a really important point. And there are a lot of, I think because, we can joke about it, but it's really important because there's a lot of people in this country who see the president not wearing a mask and may or may not listen to that full clip of the vice president, but they don't see it. And so they don't really internalize that this is something that has to be done. And it's just, risk communication, crisis communication, like actually getting correct messages to the public is so critical that it's more important. It is really important actually for every leader and every person who we could call an influencer, whether it's the president of the United States, whether it's every athlete or Hollywood star or whoever has more followings in social media than certainly public health officials. They all need to be modeling this behavior.
Yes. Well, Reese Witherspoon stepped up in the last couple of days, and she had a very kicky little mask on too. If you can rock the mask a little bit, I think it helps. So if we could talk a little bit about the future, I would guess that and this is all just guessing by both of us, but that when you have to guess, that it might be this time 2021 before you and I and everybody else gets immunized. And we also don't really know what the immunization will do, whether it'll confer a long-term immunity or short-term. There's so much that we don't know, but I assume we should be planning to live alongside this thing for at least another 12 months.
I think that's probably right. I think that there probably will be a vaccine candidate before then, but unclear at this point, how many candidates there will be, what their safety and efficacy are, and how much is able to be produced. So I think for the general population, thinking about this time-ish next year might be about the time when there might be, hopefully, a vaccine that can be distributed widely and that people want to take and they know is effective. So, I think we're going to be living with this virus for a while, but it's not sexy, it's not exciting, but we have seen what works in other countries. We have seen, and it's not that complicated. It takes work, but it's not complicated. If people are able to practice the personal behaviors of wearing a mask, of socially distancing, of having good hand hygiene, of staying home and isolating when you're sick. And that's coupled with effective public health measures. So the ability to test, and once somebody is tested, to trace all their contacts and to isolate people, and that we have a supported healthcare system that's able to provide clinical support. If we can do all those things, we've seen this in other countries, that they are able to get their numbers down incredibly low. And yes, they're living with the virus, as we all are, until, again, we have that effective medical countermeasure. But they're living with it in a very different way. They are able to actually get back to as close to normal as they can, and we're not in the United States. We're not anywhere close to that right now.
It seems to me, based on my recent reading, that another message that needs to get transmitted all over the place is that underlying good health is really, really important, given the fact that, even if we do everything that you just said, tens of millions more Americans are going to get infected with this because not everybody will do what you said. And that, we now have this interesting cohort of somewhat younger infectees. It does seem as though, in addition to the racial disparities that we're aware of, that obesity tends to be a big fork in the road in terms of outcome. Young people who are significantly overweight are having worse outcomes from a COVID infection than those who aren't. And it's one thing I don't think I hear as much as I'd like to is that idea that if you can keep your general health good, you have a better chance of getting through these 12 months. Maybe you could say something about that.
Well, it's a good public health message in general. I think unfortunately, people with underlying health conditions or obesity, diabetes, cardiovascular disease, are all of the data seem to point to the fact that people with these underlying health conditions tend to have worse outcomes. Not always, but it's certainly worse. I think there's slightly careful with messaging, because the answer isn't, if you just lose 10 pounds, you're not going to get COVID. That's not the story. But I think with COVID, just like with many other conditions, taking care of yourself and being healthy and eating well and doing everything you can is important for lots of different conditions, but also includes your ability, what may happen if you become infected with this particular virus. So always a good message to do what you can, to exercise, to eat well, and take care of yourself. And that includes taking care of your mental health as well.
So, last set of questions. You, I think, very artfully explained, what we really will probably need to do for the next 12 months. Physical distancing from one another, lots more hand washing, wearing masks, all these kinds of things that we know works. But the other component to it, to which you also alluded, is what is sometimes called Tetris, which is testing, tracing, isolating. And it seems as though we never have really gotten all the way up on our feet with that. And it's even compounded by the fact last night, and this isn't really part of the typical Tetris model, but last night 60 Minutes did this rather chilling report on the serology tests, the tests that detect antibodies in people who have been infected, that were rushed into the market without even any scrutiny at all from the FDA, and so many of those don't work either. But just, even back to the basic, PCR diagnostic testing, the tracing, the isolating, which is just, the playbook really for dealing with this. It feels like we're still not really there in any kind of uniform way.
I would have to agree. I mean, I think that it's, again, really uneven across the country. As we saw from this weekend, that people were waiting 13 hours in line to get a test in Phoenix. The lines of people who are not socially distancing, snaking around blocks in Houston. But yet in New York City, you can walk up and get a test immediately. So I think that there continues to be a lot of unevenness across the country and just the ability to access testing. We haven't quite seen the developments, the advancements that I was hoping we would see by now in terms of getting closer to a rapid point of care test that wouldn't require a medical professional to supervise. And gosh, I hope that we get there, because being able to cheaply, easily test on a regular basis would really be a game changer in helping us better understand how we reopen parts of our society.
All right. Final question, I promise. But Rebecca Katz, don't we ultimately, or would it be better anyway, if we could do some real heterogeneous testing? In other words, most of the people who are getting tested right now have some reason for getting tested. Either they're in harm's way because they're frontline workers, or maybe they know somebody who's been infected, or maybe they've been told to get it or maybe they're symptomatic. But for example, here in Connecticut, I suggested that before we reopen the schools, pick a grade, pick this fifth grade arbitrarily, and try to test every fifth grader, and you wouldn't get all of them, but let's say you got 75% of the fifth graders. You'd have a sense at that point of how the disease is seeded in this particular population that wasn't dependent on the kinds of markers that push people to the front of the line for testing, but is more likely to dig. I mean, it's sort of what has been done in other countries, even Wuhan, where they tested 6.5 million people in 10 days and found 200 people who were asymptomatic. But don't you almost have to do that to get a real picture of this before you, for example, reopen the school system?
You do, and I think that's exactly what we're going to start to see. So, I mean, right now, a lot of the testing has been focused on individuals coming forward. So whether they are initially symptomatic with a travel history and hospitalized, now are you symptomatic? Are you concerned that you had a contact? So it is really people kind of self-identifying but there's also at the same time active surveillance that's going on. And it's not huge studies, but my understanding is CDC is supposed to be running a set of surveillance studies over the summer. And I think as we start to see more companies and universities and other entities think about reopening, they're starting to do exactly what you're saying. So, what we're seeing is industry, if they're going to bring a group of people back into the office, they might do a, one-time effort to test everybody. In other organizations, maybe that they're better funded, or their people seem to be at a higher risk, they are deploying strategies that include testing everybody once a week or once every 2 weeks. And then you're seeing the sports leagues that are testing people at a much more frequent pace. So I think that as these entities start to engage in much more testing, that as you mentioned, it's not necessarily tied to a symptom or suspect exposure, we're going to start to be able to collect a lot more information on who may be asymptomatic and what the true prevalence rate actually is.
Well, Rebecca Katz, professor and director of the Center for Global Health Science and Security at Georgetown University Medical Center. Yeah, Fauci is going to get statues. You might not get a statue, but you're really, really good, and we are very grateful to have you. We take you any day. So thanks for talking to us.
Thank you so much for having me on.
All right. We'll take a break. We'll come back. We'll explain to you why the IRS has not opened the envelope you sent them.
So let's enjoy this combination. I just want to feel your love, 'cause Instagram is not enough for me. So I gotta be patient. Let's enjoy this combination.
So this next segment is somewhat born out of my own experiences. And by that I mean, I'm scrolling on this machine here too. By that I mean this weekend, or last Friday or something, I uncustomarily, a few days early, mailed in my check for my balance due, my tax due for the 2019 tax year. And I even, in a separate envelope, mailed in a quarterly payment for this year. I was very careful to select excellent Ellsworth Kelly stamps for each envelope. Took them right to the post office, so I felt confident that they would get there. And then I came back and I found out that the IRS is 11 million, or now 11 million and 2 mail pieces behind in terms of actually opening envelopes, because it turns out that although you can work from home, you cannot open mail from home. You actually have to be in the presence of mail that you are going to open. So here to tell us more about that and what that means and what that amounts to is Kelly Phillips Erb, a managing shareholder at the Erb Law Firm, a senior contributor at Forbes, a regular columnist for Bloomberg Tax, and author of the Tax Girl blog. Thanks so much for joining us today, Kelly.
Thank you for having me.
So I don't know if I summed up things. Well, I summed up my own life very accurately. You perhaps could talk a little bit more universally about what's happening here. As the IRS is kind of stepping back towards something approaching full physical strength this week, they are way, way behind on physical mail. So what does that mean?
Sure. Well, first of all, kudos to you for already mailing in your return and your estimated payments. Those aren't due to July 5th, and we've been joking. There's still a lot of people who, I think about 10 million or so, who haven't filed yet. So kudos to you. But yeah, what's going on right now is that when IRS was taking time off during COVID, and like, most of us were staying at home, they were working remotely, but obviously, you don't open the mail remotely. So they were stockpiling the mail. And I think they were saying something like it had gotten, it was well past that 11 million figure that you noted. That was the figure that the IRS told us last week that still remained remains unopened. And, as you just pointed out, they're also getting new mail every day. So there have been some real delays and some real frustrations for taxpayers. Fortunately, there are folks going back to work at IRS, and they are slowly getting back to normal. But there's clearly some significant backlog that has to be addressed. And again, on the practitioner side, we are hearing from folks who are wondering, why hasn't the IRS cashed my check? Why haven't they responded to my correspondence? And that's really what's going on, is that mail is sitting in a room waiting to be opened.
Well, there's another group of clients you are no doubt hearing from saying, where is the check that the IRS should be sending me, right? Those people who, a lot of people, I guess, get direct deposit. I assume that's less affected by all this stuff. But there are a number of people, I assume, waiting for conventional, good old physical checks.
Sure. Well, so one of the things that is clear is that electronic submittal of returns and payments are being processed more quickly. So if you are one of those folks who did electronically file a tax return and you were due a refund, chances are that you probably already received your refund. Now, that doesn't apply to everybody because, as you noted, some people are getting paper checks, and some people also require a little more scrutiny or a little more time with respect to looking at their return. But what we're really hearing from in terms of people who are really frustrated are folks who paper filed. It's funny because IRS downplays the paper filings because so many of us file electronically now. But even if you say 10% of folks, filed a paper return, that's still 14 or 15 million taxpayers. And then on top of that, you have folks who might have amended because this was a really kind of out of the ordinary year. And a lot of folks were changing their returns specifically because they were trying to change their tax situation to qualify for those stimulus checks. So a lot of folks ended up sending in those amended returns, and those could only be filed by paper, and they're still waiting for their checks too.
Right. So one of the questions that occurred to my tax preparer was, so I'm filing electronically like a lot of people, but for this other stuff, I was mailing in a check for the amount that I owed them for 2019. And as I said, yes, the estimated payment as well as a mailed in check. But given the fact that they are unlikely to open those envelopes for a while, there may be like a computer that will trigger at some point some kind of warning to me, particularly about the balance due, right? I filed electronically, so it's going to know that I owe them something, but I paid physically, so they're not going to know that I did it.
Right. So, kind of the key word for right now is patience, because the IRS has acknowledged that that's going to happen. They also have acknowledged that prior to the shutdown, they had, I think, somewhere in an area of about 20 million notices that were queued to go out, and they didn't get sent out. So those notices are going out now, but they're going to be dated like March of 2020. So you could have resolved the issue that they're contacting you about since that time. So what they've started doing is putting in an extra notice in the notice that you're receiving. So you'll get two notices at once. One of them was the original notice saying that, as you're saying, you might owe when you really don't, or you might have had to send something in when you really didn't, or you might need to send something in and you haven't yet, but the deadline appears to have passed, but that's no longer the case. It's actually, still they're going to give you some extra time. So there's this extra notice that they're putting in to the notices that you'll get. And it'll basically say, we're including this notice to let you know that you have extra time to submit either an additional answer or paperwork or a payment. So I think that there's going to be a lot of worried taxpayers, because nobody likes to open mail from IRS anyway. So again, kind of the key is to be patient and hope that IRS can work through some of these issues. And also, if you do have a tax professional, as you mentioned that you did, work with them to stay on top of this. And that's not the same as calling them every week to, ask where my refund is, because they can't help you either, because they can't, they can't read into your transcript or what's going with IRS any more than you can. But, just kind of be patient and not to fret as much, because I am seeing that with some of my taxpayers where they're nervous because they got a notice that says you have 30 days from the date of this notice to respond, but the date of the notice was April 4th. So again, IRS is going to give you some grace on those.
Right. I would like to say that although you are an extraordinarily lucid speaker and very good at explaining things, some of what you just said over the last couple of minutes is still kind of confusing because it's just such a hard thing to explain. I don't know that anybody can possibly explain it. I will tell you that my tax preparer took a different tack, which was to call me up and say, hey, maybe you should make your payments, see if there's a way to do it by some kind of electronic transfer, so that you're not using a check, in the mail and stuff like that. And I said, no freaking way. That's their problem if they can't find my check. But that might not be the best attitude for me to have, Kelly.
Well, I think that's great advice on your tax preparer's part to advise, because that does speed things along. But I'm with you. I actually still have a checkbook. I use it rarely, but IRS is one of those instances where I use it because I just like to have the paper, notification that I sent it. I have my evidence in my file. I like it, and it just something about I guess maybe working with taxpayers and checks all these years. But I prefer the check, but the IRS does encourage folks to use the electronic payments because it is faster and there is less chance of an error. That said, you're not going to be penalized for sending in that check. And I would also say, because where I thought you were going with this, but you didn't, is I thought you were going to say that he told you to make a payment in addition to the check. Because I have had people ask me about that. Should I send in another check? And I would say no, because what happens then when they cash the check that you were waiting on, and then you've already made payment, then they're going to have your money twice. Right. And they're not going to be inclined to refund it promptly. Although, and I do have some good news for taxpayers, which is folks who were waiting on those refunds, the IRS has actually changed the way they're paying interest this year. Mm-hmm. So they will start paying interest for refunds that have not yet been received as of April the 15th.
Right. The refund has to be issued after April 15th, I guess, for that to happen. But interest, amazing. Kelly Phillips Erb, you are a very lucid speaker indeed and very helpful managing shareholder at the Erb Law Firm, senior contributor at Forbes, regular columnist for Bloomberg Tax, and author of the Tax Girl blog. Thanks for doing this with us.
Thank you so much for having me. I appreciate it.
All right. In our final segment, which is coming right up, you may have been hearing just what you needed in this uncertain time. Lots of loud explosions not far from where you live. We'll discuss. I don't take it all. 'Cause I'm the tax man. Yeah, I'm the tax man. If you drive a I'm back. And by the way, it's good to be back. And it's good also to hear the voice in my headphones of Kat Pastor. She's in the studio, keeping us on the air, making it possible for others to work remotely. So thanks, Kat, and thanks to Betsy Kaplan, senior producer and producer of this particular episode. And it's just great to be back working with the whole team. Tomorrow, we are going to do a show. It's actually a show co-produced by one of our interns. It's a show on curfews and on the history of curfews. And the history of curfews, as it dates back even to the Middle Ages and earlier, is a pretty fascinating one. But obviously, we saw them, all around the country during the times of unrest in recent weeks. Okay, so we're going to move onward. And speaking of unrest, you may not be getting as much rest because, yes, there are a lot of things going boom somewhere near you. I live about a block from the Hartford City line. The Hartford police tweeted, "We have been receiving upwards of 200 calls a day in regards to fireworks in the city. Those with PTSD, babies, children, elderly, and pets have to endure the night noise. Call this line. They have a number. They have a fireworks text line for you to call. But Hartford is not unique. Syracuse police claim a 335% increase in fireworks. In Boston, police recorded 1,445 fireworks complaints in the first week of June compared to 22 in the same week the previous year. So there's the question of what's going on, and then also the always interesting question of what do people think is going on? And here to address both of those is Caitlin Tiffany, staff writer at The Atlantic. Thanks for joining us today.
Hi, thanks for having me.
So, in the ways that I just noted, I mean, I think that we're past the point where there's any question that there's more fireworks and louder fireworks than in a typical year. It isn't just people's imaginations, I assume.
Correct. Yes. Definitely not anybody's imagination, although there has been some speculation that people are noticing it more than they might have otherwise, just because they are at home all the time rather than out and about in summer. When you're already partying, maybe fireworks wouldn't bother you as much, and we're doing less of that. But there definitely are a lot more fireworks.
Right. Yeah. No, if you're really drunk, you don't notice the fireworks so much. We'll sort of end, I think, with what probably is really happening here. But conspiracy theories abhor a vacuum. So in the absence of any kind of cogent explanation, it seems as though a whole bunch of ideas spooled up about what could possibly be driving all this. What did you learn about this?
Yeah, so I started noticing the conspiracy theories, not this past weekend, but the one before, sort of just as comments were bubbling up on Reddit and on Twitter from people saying, the fireworks are happening in my city, in my city, in my city, which made it feel very coordinated and unexplained to a lot of people. And particularly, I live in Flatbush in Brooklyn, which is where there have been so many fireworks that there's been police in riot gear out here a couple of times. So people in New York in particular were like, these don't look like normal fireworks. These look like professional fireworks. Fireworks of any kind are illegal in New York. Where are people getting these? Perhaps the police are providing them, or the government is providing them to kids to use them as pawns, basically to lead to like sleep deprivation, like tension, confusion in communities that had been particularly supportive of the Black Lives Matter protests, as much of New York was.
Right. There's an odd dual edge to this because, and we'll come back to that in 2 seconds, but yes, there seemed as though that was happening in communities where people of color live. On the other hand, and I've experienced this around here in very liberal communities, and I know it's happened in Brooklyn as well, there's been a sort of don't complain about the fireworks because you might be complaining about people of color who are very frustrated and letting off steam right now. And there might be almost something a little racialized about your dislike of hearing fireworks in, Park Slope or wherever. So, but let's go back to this other thing, because one of the key players here is a novelist named Robert Jones Jr. Explain what it is that he put out there.
Yeah, he put out a Twitter thread and then a Facebook post that had the same text as the Twitter thread, both of which were shared, upwards of 15,000 times within the first couple of days. And the thread suggested a couple of different possibilities. One was that police were giving fireworks to kids for the reasons that I was just saying, to cause disorientation, and another was that the government was possibly setting fireworks off themselves to desensitize people to the sounds of like artillery. And that was I think not really explained exactly what that would be preparing people for. He said a war zone, because it's about to become a war zone. I think people were spreading that conspiracy theory a little bit less than they were the theory that police were either giving kids fireworks or just kind of ignoring fireworks in an effort to be kind of like, well, you guys protested against us. Now you need us to come take away fireworks or whatever. That theory was probably the one that people circulated the most, but Robert Jones's was certainly the most dramatic.
Although the conspiracy theories are kind of all over the map, and so whoever feels put upon by somebody else basically can take this narrative and meld it into their own appropriate conspiracy theory. And I know this because today, as I mentioned that we were going to be tackling this topic on Facebook, I got a very, very long posting from a guy who wanted to tell me about his friend Chris. Somebody should investigate this person Chris, because everybody seems to have a friend Chris who tells them about some horrific conspiracy that has no basis in reality. But anyway, what Chris is saying is that it's Antifa that's doing this, And what they're doing is they're testing police response times, and they're kind of getting local residents acclimated to the frequent sounds of explosions that sound like gunfire. It's also a chance for Antifa to figure out how much law enforcement strength there is in terms of response, so that Antifa can eventually move in and do all kinds of horrible Antifa things that I'm not going to bother to repeat because it's all nonsense. But it really does seem as though, in these uncertain times, to use the cliche, when there's some other kind of anomalous thing, Caitlin, like more fireworks than usual, louder fireworks than usual, anybody who's got an issue can kind of fold this in as a story.
Yeah, I think we've known for a long time that conspiracy theories usually give people a way to explain something strange in a way that fits in with the worldview that they already have. So in that case, yeah, I mean, that sounds like somebody who has really been taken in by this idea of a violent, anarchist, radical left. And they see this as fitting into that story, whereas people who have been developing for years a distrust and fear of the police, which is obviously a reasonable distrust and fear, could also fit this into that worldview in the same way.
Right. I mean, I think you quoted a professor who studies conspiracy theories. You start with a fact pattern that everybody agrees on. So there's fluoride in the water. Nobody questions that there's fluoride in the water. Then the question is fluoride a good thing or a bad thing? And you sort of jump off from there. And at this point, as we said at the top of this conversation, nobody's really questioning anymore. There's more fireworks out there than usual. And they do seem a little louder and more professional grade than amateur fireworks, in your city neighborhood or whatever. So you start with that. And then I think part of the strength of a conspiracy theory is you could track it back to that one thing that everybody agrees about, that there is a fact, and you just imposed your own craziness on it.
Yeah, definitely. And I think that's been happening a little bit during the protests in general. I know on the other side of things, there was the conspiracy theory that some employees of a Shake Shack had deliberately poisoned some police officers, which circulated for a while before it was proven completely false. I think there's just a lot of really dramatic events happening, and it is kind of hard to decide what is definitely fact and what is definitely fiction when we're all kind of sitting in our homes, turning to Twitter for information. I think that's definitely challenging, even for me as a journalist. I watch things unfold on Twitter before they're in the mainstream news, and oftentimes I'll see things that turn out to be totally false, and you don't know right away. I guess the other thing I would say is that because conspiracy theories are usually based in some fact, and the other side of that is that even if they aren't based in fact, evidence can come out later that proves them correct. So this theory that the police have been terrorizing communities with fireworks, obviously, I don't think there's a lot of evidence for that. But at the same time, you can kind of see where people are coming from, because the government has sabotaged civil rights movements in the past, and it has done so with, really underhanded or deceptive techniques that, not specifically fireworks, but, writing anonymous hate mail to Martin Luther King Jr., that kind of thing really happened.
All right, we're going to have to stop there. But Caitlin Tiffany, thank you so much for your time, staff writer for The Atlantic. Yeah, I'm going to take a wild guess that it's bored people who haven't been able to do a lot of the things that they would ordinarily like to do. There also might be a little bit of access to surplus fireworks because so many public fireworks, 4th of July exhibitions, official ones in cities, have been canceled. Healthy skepticism means that when you hear hoofbeats, it's probably horses, not zebras. But every once in a while, a zebra gets out there. So as Caitlin is saying, don't just dismiss these things out of hand. All right, we have to stop. Thanks for listening. Good to be back. We'll be back tomorrow with the show about curfews.
When the smoke gets in your eye.